AbbVie may be able to help.
To the heroes working on the front lines, thank you.
Now, you're watching Wave 3 News Listens Live.
And it is a celebration.
With your host, Jon Ramsey.
Welcome into the Wednesday edition of Wave 3 Listens Live. I think we can all agree that a smile in person is a lot better than via Zoom or a FaceTime chat or whatever the case may be. Yeah, your smile is really your personal business card. It's that first impression, and that's what we're going to talk about today with Dr. Regan Ackerman of Freedom Mini Dental Implants. Dr. Ackerman, welcome back to the show. Your smile is absolutely beautiful.
Thank you.
If you would, tell everyone what you're all about. And it is a lot about the superficial, but there's more to it than that, right?
Yes. You know, superficial smile is important, but function is definitely important. Everybody wants to be able to eat, you know. Eventually, when we're able to go out to restaurants, go to that restaurant. But right now, you know, order off that takeout menu, that carry-out menu, whatever you want to order. So what I do on a daily basis is I help people, you know, replace a missing tooth, especially people with dentures. There are so many people out there struggling in silence with their dentures, using tons of denture glue, you know, afraid their denture is going to fall out, not going to social functions, you know, can't eat what they want to eat. So with the mini dental implant, it's just a lot less invasive implant, usually a lot less expensive way to keep dentures in or get rid of the denture altogether. So, you know, have permanent teeth and not have to worry about a denture, no longer have anything on the roof of your mouth. So that's what I do on a daily basis, is help people out in those situations.
Yeah, throw away the dentures. And you listed, or you mentioned some of the positives, and it is all positive. First of all, less costly, less invasive. Yeah, we've all heard about that old method, about all the surgical, and you have to wait, and there's all these kind of things going on. And this is really no more than really numbing.
Exactly.
And then it's very precise. It happens very quickly. It's less costly. It happens fast. So if you've been apprehensive about throwing away those dentures, you're tired of the glue, you're tired of them being ill-fitting, you miss the foods that you mentioned, Doc. I mean, carrots, vegetables, steak. There's so many of these, and you probably hear from your patients all the time about how much they miss the food they love.
Definitely. You know, steak is definitely top on the list. Peanuts, pretzels, salads, things that we take for granted every day for, you know, if we have our own teeth. But these people are struggling with, you know, eating those foods and having good nutrition. And like you said, the mini implant is a lot less invasive. When I place these implants, you know, I don't have to put you to sleep or anything. I'm not making any incisions, no stitches, very minimally invasive, so it's less healing time. You know, the mini implant, it's just a smaller diameter implant. I know we'll show the models later, but it's just, you know, it's a win-win for everyone.
All right, before we introduce you to today's patient, the before and after pictures, before we do that, let's talk a little bit about confidence and how much a smile means, because we've all met that someone, and maybe it's someone special to you, who covers their mouth when they smile. They avoid taking pictures. They're just not comfortable with their smile. And I think, don't you agree, doctor? And I know as a dentist you do, but I mean, everyone deserves to feel confident about their smile, right?
For sure. I always say, you know, I don't wish anybody to have a regular denture. We have come too far in technology these days, you know, for someone to be struggling with a regular denture and having to use all that paste and glue and, you know, covering their smile up. Like you said, not going to social functions. You know, we've come so far in technology, especially with these mini implants, that, you know, everyone deserves to have at least an implant rotating denture, for sure.
All right. Well, we'll go into detail about the procedures, and there's a couple of options that Freedom Mini Dental Implants offers. But before we do that, too, and before we meet Chris, I have to ask you, though, okay, business right now. You are up and doing business, right?
Yes. So we got to do, I called it our grand phase 1 reopening last week. Of course, we've always been open for emergencies, but last week we were able to, you know, start seeing patients on a normal basis. Of course, we're taking all the extra protocols, taking temperatures. We have a small office, so we really only have one patient in the office at a time. All the extra, you know, extra mask protocol. So, but it's been so nice to get back to work, and we have lots of new patients coming in that are ready to do this treatment, and they've been, you know, waiting for it, and especially, you know, being at home, and everyone's eating right now at home, right? That's all we do is sit at home and eat. So everybody wants to be able to eat again. So, but we are definitely open, and just with extra protocols.
I know on a personal level this is nice for you because you tend to become friends with your patients. You get to know them well, and you're changing their lives for the better. So without further ado, can we meet Chris?
Certainly. So yeah, this is Chris, truck driver, had dentures that he just struggled with, didn't really, I don't even think he wore them much, you know, and he wanted to be able to eat, and especially while he was driving, eat all those good snacks and, you know, be healthy. So we were able to do the snap-in dentures for him, and obviously, you know, it changed his smile dramatically.
Look how much younger he looks.
Yes, and able to eat better, have that confidence, and get rid of the denture glue especially, and start wearing his dentures. So many dentures, you know, if you're out there and you have a denture, you know, I have so many patients come in and I say they wear them in their pockets because they don't wear them. They just keep them in their pocket or their purse, and they stick them in when they have to. So for Chris, we were able to do the snap-in denture, and, you know, I'll explain later, but you wear these dentures 24/7. You're going to sleep in them, but you're able to snap them out, rinse and clean them, and put them right back in. And as you can see, you know, Chris, it just increased his smile, shows his teeth more, and just, you know, confidence booster, and able to eat again.
Yeah, you know what's interesting here is the before picture, yes, he's attempting to smile.
Yes.
It doesn't look totally genuine. The after picture looks very authentic. I love it. And Chris, handsome individual, now he can smile and feel confident. Now, you mentioned snap-in dentures. There are two procedures, and I know we're going to go into detail in the next segment, but if you would, one of them is a snap-in denture, so no more glue, no more ill-fitting. They're very, very tight.
Right.
And the other one is not a denture at all. It's like having your third set of teeth, right?
Exactly. You get rid of the denture completely, and the teeth stay in permanently. So they don't come in and out. It doesn't cover the roof of your mouth, so you get to taste food again. You know, just have the stability, and it's just, like you said, it's like your third set of teeth. I have a patient told me, I feel like I grew my teeth back. So those are the permanent teeth, which we'll show, you know, in the next segment, versus the snap-in denture. The snap-in denture is a great option still, but, you know, if you can do the permanent teeth and get rid of the denture completely, it just makes, you know, a huge difference not to have any of that plastic in your mouth.
I have to tell you, when you first started appearing on the show, formerly Dr. Stroud, and now you, Dr. Ackerman, I thought, okay, this is too good to be true, because that's what's great about this show, that we can expose people to things they're not familiar with. Because I'm a little bit older, I did not know about this technology, although it's been around over 15 years now.
Yes.
So when I found out about the technology, I said, okay, I'm going to get on the internet and start reading. And usually, when you get on the internet and start reading, you read a lot of negative. But everything about this was positive, and the outcomes were positive, and the reviews from patients was good and life-changing. I wish I'd have done it earlier, and all these kind of things. You hear that every day. That has to be rewarding for you to hear all the good news.
It's very rewarding what we do. You know, just this week I was able, you know, we submitted in permanent teeth, and, you know, just tears of joy from this patient because they had, you know, struggled with their teeth forever and had dentures. And, you know, we always say we never got hugs for root canals, but we do get hugs for changing people's smiles. And like you said, the technology has been around for, you know, 15 years. Obviously, you know, a lot of patients come in skeptical. Once we show them, you know, the models and explain the process and the technology, you know, it makes sense. But this has been around for 10+ years, and like you said, Dr. Stroud had been doing it. I see patients every day that he placed implants on, you know, 10, 15 years ago, and their implants still there, still great. So, you know, and a lot of people don't know about the technology because, especially if you've had dentures, you haven't been to a dentist in years, and you don't know that this option is out there. Your current dentist may not know about, you know, the technology. I've taken a lot of continuing education courses on the mini implants to be able to do these and provide these to my patients.
Yeah, so cutting edge technology, although it is not, hey, it's tried and true, it works, and you can throw away your dentures. How does that sound? If you have a bridge you'd like to get rid of, what they call a flipper you'd like to get rid of, a tooth or two, we'll show you how it works in the next segment. But if you have a question, we'd like to hear from you. Dr. Ackerman will address any call, 571-5263, 571-5263. Smile with confidence with Freedom Mini Dental Implants. We'll be back after these.
To the hardworking folks who stock our shelves, the dedicated people who protect our families, to the brave healthcare workers putting their lives on the line, and the resourceful drivers delivering for you. The warehouse workers, firefighters, emergency technicians, and cooks. Every person in business pitching in. You are the unsung heroes of our new normal. Wave 3 News says thank you. You are the spirit of Wave Country.
As a critical infrastructure, CSL Plasma's donation centers are remaining open to collect healthy plasma from those who can do so safely. At each center, we have instituted temperature readings, are practicing social distancing, and have enhanced disinfecting procedures in place to ensure everyone's safety. Your plasma donations help develop life-saving products for individuals suffering from life-threatening conditions. Plus, you'll earn up to $400 while helping others during these uncertain times. Together, we can help make a difference for so many. For more information, go to cslplasma.com.
Welcome back. Freedom Mini Dental Implants. If you have questions, maybe you have a loved one who wears dentures. Perhaps you have a child who's missing a tooth or two, and they don't feel confident about their smile. We can help you. Or actually, Dr. Regan Ackerman can help you. 571-5263. We've asked for calls, and we're going to field one. Mary joins us now. Mary, welcome in. You have a question for Dr. Ackerman. Hello, Mary.
Hello.
Hi.
I was wondering, what if you still have teeth, a few teeth anyway, and they need to be pulled? They're not very good teeth.
Yes.
Do you all do that?
Yes, so great question. We see patients in your situation all the time. So yeah, what will happen, I always tell people you're never not going to be without teeth. We would take impressions, and just depending on what option you choose, but you know, and have either a denture or teeth made for you. The only thing you won't do at our office is the extractions. We still refer out to an oral surgeon, but the day the teeth are taken out, you'll start wearing, you know, those dentures. There is a little healing time involved until we can place the implants, but you'll never not be without teeth. So that's a great question, but you know, the bone does have to heal up, you know, anywhere from 3 to 4 months before we can place the implants, but there are options where you will, you know, have a denture or something to wear while you're healing until we can place the implants. But the nice thing about the mini implant, once we place the implant, we can usually, you know, use it right away. You don't have to heal up another 3 to 6 months, opposed to the surgical old method. They place the implant, you got to heal up another 3 to 6 months. I mean, it can be a whole year-long process sometimes with the surgical method versus the mini implant. It's a lot less healing time. So great question, but I see a lot of people in your situation. So I'd definitely call, and you know, we do consults at no charge, so it's definitely worth coming to the office. We'll do a 3D x-ray, consult, kind of explain the process, and you know, go over your options and costs and see what we can do for you. So thank you.
Thank you for the call, Mary. And if you're like myself, the point of reference would be the old method. And I promise you this, a lot less expensive. Now, I know every case is different, Dr. Ackerman, but up to a half or a third less expensive. So this is a great option. It's just as durable. It's tried and true. And like you said, less invasive, not all this expensive surgery and recovery time, right?
Definitely. If I could show this model real quick, I think that might help answer some questions too. So this model kind of shows the difference between the mini implant. That is the small hole right there.
I can barely see it.
Exactly. So when I place an implant, I'm making the small hole versus the surgical method. That's a much bigger hole that they're making. So when I place this mini implant, like I said, I'm not doing any incisions or stitches. And also, because I make a much smaller hole, I'm able to do implants on a lot of people that were told they weren't a candidate for implants before. Maybe you were told you had to have bone grafting or sinus lifts or things like that. I don't have to do that because I make a much smaller hole. And with this surgical implant, you know, if you're just replacing one tooth, I know I see it every day. A lot of people, it can be about $4,000 to $5,000 a tooth for a surgical implant, and it's a year-long process. Versus the mini implant, I mean, we're about half the cost of a surgical implant, and a lot less healing time. So it's definitely worth it, you know, to come to the consult and see, you know, about the mini implants and if you're a candidate for it.
571-5263, and while we're waiting on calls, if you would, let's take a look-see at the two methods. Now, you mentioned the snap-in denture.
Yes.
And then your third set of teeth, which is no plastic whatsoever, and they're both great options. So if you would, please.
Yes. So I'll start with the snap-in denture, which is kind of one of the more common procedures we do. So imagine this is your mouth without teeth, and then these little kind of studs, those are the mini dental implants. And like I said, they're just a smaller diameter, so they're a lot less invasive. When I place these, I'm just numbing up the gum. I don't make any incision or stitch, and then I place the implants. Now the same day I place the implants, we'll put these attachments in your denture, and you will leave with your denture that same day snapped on to those implants.
Now, if you need new dentures, you can handle that as well, right?
Yes, yeah, we can make new dentures or use your existing denture. So, but you will wear this denture 24/7. But you'll be able to snap it out yourself.
Very secure.
And rinse and clean. Yeah, but then with the snap-in denture, you don't have to worry about using denture glue anymore. I mean, it is secure. You don't have, you're able to chew and eat so much better. It's just a lot more security, the confidence to know that your denture is going to stay in. So this is the snap-in denture route.
All right, we've got plenty of calls. I want to show the other method, but let's try to field a couple of calls because the other method, you're going to love it. All right, let's grab Sarah, who joins us now. Sarah, welcome into Wave 3 Listens.
Yes. I have my teeth pulled about 20 years ago, and my gums have receded really, really bad. They are so thin, and I haven't been able to wear dentures for probably 15 years. And I'm wondering if, I would be eligible for this.
Great question. And I have seen a patient in your exact scenario. Wore dentures for 20 years, bone had resorbed, and we were actually able to do the permanent teeth for her. But the best way for me to answer your question is to set up a consult where I take that 3D x-ray and just see how much bone you have available. And if because chances are, like I said, a lot of times with the mini implants, you don't have to have as much bone as with the old surgical implant. So it's definitely worth coming to the office for the consult to see if you're a candidate. But I have definitely seen people in your situation, they've been missing their teeth for 15, 20 years, and they're still a candidate for the mini implants. And we've been able to, either give a snap-in denture or permanent teeth, just depending on the situation. So it can be done. The best way to find out if, you're a candidate is coming to the office for the free consultation and the x-ray.
Yeah, you told me, Dr. Ackerman, before that it is rare that you tell someone no.
It is pretty rare. I'd say 90–95% of the people that come into my office are candidates for the mini implants. So it does break my heart when I have to tell somebody they're not a candidate.
But it's rare. Give them a call. The consultation is free. Let's grab another call. Virginia is nice enough to call and watch. Virginia, you have a question?
Yes, sir. I'm sorry. I had a question about the bone, and I think you answered that while I was sitting there. But
ask again.
Yeah, I think you did. But the question I had, too, also was the price on the mini implants. That's something you have to look at, or...
The price, is that what?
Yeah.
Yes, yeah. So like I said, everyone's situation is different. So best thing is, coming in for the consultation. But I will tell you, people come in with treatment plans for the surgical method, and a lot of times the quote I give them for the mini implants is anywhere from a third to half the cost. We do have financing plans too, which is a great option for people. It can go up to 2 years with no interest. So there's definitely ways, to finance it, but it's definitely usually less costly than the surgical method. So I hope that answers your question.
All right, I've been teasing the permanent teeth method, so I think we have time here to take a look-see. This to me is incredible, and as I said, very little downtime, not invasive, not as expensive as you may think at all. Give us a look-see, because I think this is really interesting.
Certainly. So this model, so these are the permanent teeth. There we go. So very similar situation as far as putting the implants in.
So that's your mouth, no plastic.
Yeah, this is your mouth. This whole pink thing does not go in your mouth, but imagine that is your mouth without teeth. But same thing, we're just going to put more implants in, but when we place these implants, still no stitches, no incisions, just numbing up the gum and making a tiny little hole and placing the implants. And then we're able to make just a bridge of teeth. And as you can see, you get rid of all that plastic of the denture. And this bridge of teeth will cement on to those implants. So it cements on or glues on to the implants permanently. So you cannot take this in and out. You're going to brush your teeth just like you usually do, and we give you a water pick, a water flosser, to kind of keep the edges clean. But then you don't have anything on the roof of your mouth. You get to taste your food again, and you just lose all that kind of bulkiness of a denture. And like we say, it's kind of like getting your third set of teeth back. The best thing you can do, to feel like you have your natural teeth back. So once again, this is the permanent option.
All right. So I'm thinking that after I get Freedom Mini Dental Implants, my first reservation is at Jeff Ruby's. Big juicy steak, lots of vegetables. That may be the case with you as well. All right, 571-5263. If you have a question for Dr. Ackerman, again, consultations are free. Freedom Mini Dental Implants. We'll be right back.
Attention Kentuckiana! CBD Pure Hemp Oil in Prospect has purchased a large quantity of full-spectrum pharmaceutical-grade CBD and dramatically reduced our CBD Pure Hemp Oil while supplies last. 1,000 milligrams, $55. 3,000 milligrams, $150. This is a limited supply of 98.93% pure pharmaceutical-grade CBD. We are in this together. Make sure to follow CDC guidelines to protect both you and your family. Please stay safe during these uncertain times. If necessary, we will deliver your sanitized CBD to your doorstep in the Louisville area. Call for details 618-1222 or stop by CBD Pure Hemp Oil in Prospect for dramatic price reductions while supplies last. If you live outside the Louisville area, go to cbdpurehempoilky.com and at checkout enter the promo code TOGETHER for your discount. We are in this together. Please be safe. CBD Pure Hemp Oil.
Dr. Regan Ackerman is with me, and we're talking Freedom Mini Dental Implants. Yes, all the news is good, but we do field calls because if you have questions specific to your situation, then Dr. Ackerman is happy to field them. All right, let's grab one. LaRonda joins us now. LaRonda, welcome to the show. You have a question?
Yes, I do. When I was working, I ate a hamburger one day and it chipped my tooth. And since I've retired, I've lost 3 of my teeth have broken off in the front of my mouth. And I was wondering, what could I get done to my teeth? Because I have all my permanent teeth. And I'm 73.
So you're worried about your current teeth, how long they're going to last you, or if they need to come out, it sounds like. And there are ways, and we're going to show another model here in a second, to where if it just happens to be those 3 teeth that need to be replaced with mini implants, we can do that with the mini implants. It doesn't have to be all your teeth, okay? So if your other teeth are in good condition and you keep those teeth, we can replace just those 3 teeth that you mentioned that were broken and may need to come out. And then once again, as we've been talking about, if all the teeth need to come out, there is definitely still a way to do that where we take impressions first and get things set up first before you get all the teeth taken out. But like I said, you'll never not be without teeth. Even when we do just the 3 teeth, you'll still have a temporary or something. So yeah, if it's just those 3 teeth you're worried about, we can replace those with the mini implants as well. So once again, I invite you, just to make an appointment for the free consultation, and so I can see you in person and see exactly what your situation is and give you all your options.
Dr. Ackerman, before we take another caller, if you don't mind, show them that model, 1 tooth, 2 teeth. It doesn't matter if maybe you were born with a genetic defect where you're missing a tooth or 2 in front. That's okay. Maybe you had an accident, right? You can take care of them.
Yes, yeah. So this model shows, we'll start with the front tooth. So many people, like had an accident or trauma and they've lost this front tooth. So same thing, we can do just 1 implant, 1 mini implant, and the day I place this implant, you will leave with a temporary on there. You get rid of your partial or your flipper or whatever it is that you have been struggling with wearing, or you may not have anything at all, you're just missing that tooth. But then we'll have a nice pretty tooth made for you, and that tooth cements on to the implant, and it cements on permanently. So once again, if you've had that partial or that flipper that came in and out and moved around, then you no longer have that. So many people are missing their back teeth. what I call your big chewers. So a lot of people that are missing, your molars, we can replace 2 or 3 teeth at a time as well. Same thing, we're going to place those mini implants, no incisions, no stitches, and then we make just kind of a bridge of teeth, and those will cement on to those implants permanently. It doesn't come in and out. Like I said, it's kind of like growing those teeth back, and then you don't have to worry about that partial, that flipper. You can taste your food better, have the confidence of your smile so much better. Some people are born without certain teeth, a lot of people in the front, and I've treated a lot of patients, especially a lot of younger adults that either couldn't afford the surgical implants or didn't have enough space for a surgical implant. So we were able to replace that tooth that they were born without, and they've been wearing, a flipper all through high school and struggling, and then we can replace that tooth with the mini implant. So it's a great option.
Let's try to grab one more call real quick. Ron, you have her full attention. Go ahead.
Okay, Dr. Ackerman. I've never met you, Dr. Stroud, replace my lower plate, and I have 5 implants that hold it in. It's been about 8 years ago, works great. But back next to my wisdom tooth, I lost 1 tooth, and I've got one that's a little loose. My question was, are they made together 2 teeth at once? Are they separate teeth, or when you put them up there?
Yes, I'm trying to understand correctly, but yeah, if we're talking about just, 1 tooth, we make it separately. But if you're missing 2 or 3 teeth all next to each other, then we do splint those teeth together, if that's your question. They do, it just adds strength to where we splint them together like a bridge, if you're missing, 2 or 3 teeth right next to each other. So, but really glad that your implants are still working out great for you. Thanks for calling.
Makes perfect sense. Freedom Mini Dental Implants will be right back to put a bow on this show.
Well, as Louisville begins to reopen, I'm Tim Jones back for Toyota of Louisville. Come visit our safe and clean showroom where you can take advantage of $1,750 cash back on a brand new 2020 Avalon. Toyota of Louisville, a swope dealership where nobody walks away.
The COVID-19 outbreak is quickly changing our day-to-day lives. Through these unprecedented times, our law firm is committed to the safety of the community that looks to us for help. If you're afraid or unable to leave your home, we are ready to serve both new and existing clients through virtual meetings and electronic signatures. You can reach us 24/7 by phone or online. Your well-being will always be our #1 concern. Hurt in a car? Call Sam Aguiar, 888-8888.
Our Clean Safe showroom is open. Tim Jones back for Toyota of Louisville. Here's how we can save you money on a brand new Highlander. Right now, get $750 TFS cash when you finance through Toyota Financial Services. Toyota of Louisville, a swope dealership where nobody walks away.
Freedom Mini Dental Implants open for business, and Dr. Ackerman, again, free consultations, right?
Yes, free consultation, includes a 3D x-ray. Just come see me and we'll go over all your options.
There you go, Freedom Mini Dental Implants. There's the number on the screen. Have a great day, and we'll see you tomorrow for the Thursday edition of Wave 3 Listens Live. Have a good one.